Okay, so this is lecture number 3 on demography. In our last two lectures, we have already discussed that what is demography and different types of sources of data. And amongst different sources of data, we have discussed census in detail. Today, we will be discussing the other sources of data and population pyramid and dependency ratios. So let's move forward with the sources of data. Uh, Other than census, which we have discussed in detail, that it has two types, de jure and de facto. It is conducted after 10 years. It has three phases: pre-enumeration, enumeration, and post-enumeration phase. And then how the sixth census of Pakistan was conducted, and what were the forms which were used, how the data was coded, how it was monitored, how the officials were collecting data. We have discussed it all in our last lecture. So today we will be discussing the other sources of data, which include demographic surveys. As the name is suggestive, the demographic surveys revolve around only the populations. They study the parameters of the populations, which we have discussed in detail in the census. But the difference between demographic survey and census is that census covers the whole population, and demographic surveys are conducted on the individual basis, and their results are dependent on the samples which are taken from the population. Surveys will only be representative of the census population if the representative sample is taken within the survey. Then we have registration systems: births, deaths, migrations, marriages, divorces are registered, and they also reflect the population statistics of a country. We have system of national database entry, which is known as NADRA, and all the vital statistics are actually gathered by NADRA. Then we have population registers, again, our national agency of data gathering, which is NADRA. It maintains the population registers as well. Other sources of data also include service statistics. The service statistics means that we want to know that what is the healthcare service utilization rates. What are the rates of patients coming to the OPD services? What are the rates of the patient which are admitted? What is the mortality rate which is hospital based? We want to know that what are the services, for example, immunization services, which are utilized by the government, by the population. We want to know that what is the ratio of the population which is using family planning methods. So all the services which are provided by the government for the healthcare service utilization are also basically monitored, and we maintain the sources of data through service statistics as well. Then we have migration statistics. In migration and out migrations registers are also maintained, and it is calculated on annual basis that what is the in migration population number and what is the out migration population number, and what are basically actually the reasons for the for the migrations. Then we have quantitative and qualitative data, which is gathered in different researches, which are done at the national level, at the regional level, or at the academic level. So surveys. In surveys, we have multiple varieties of surveys. We have national health survey, which are conducted at the provincial levels, and at the then from the provincial level, we isolate these different geographical boundaries, and we conduct national health service, which only target the health status of the population. For example, we want to know that what is the common communicable diseases are present, what are non-communicable diseases present in the population, what are disability rates, etc., etc. Then we have Pakistan Demographic Survey, which only concentrate on the characteristics of the population. It does not concentrate on the health survey. But in the last 20 years, with the funding of the United States of America, Pakistan has merged National Health Survey with Pakistan Demographic Survey, and a new term, Pakistan Demographic Health Survey, has been originated. So PDHS is a total survey which is conducted in collaboration with the United States of America, and it not only represents the demographic characteristics of the population, but it also depicts the health status. Then we have NADRAS with us, NADRA, which is the National Database and Registration Authority. It only targets the births, deaths, migrations, and it also targets the divorces and the marriages rates as well. Then we have Health Management Information System that is established for the first level healthcare facility by the government of Pakistan. It again helps us to collect data on the health services, on the health status of the population. It also helps us to calculate resources which are required for the uh, health for the health service. So basically, the health management information system helps us to plan things according to the statistics which are generated at the first level healthcare facility. As I have already mentioned that in collaboration with United States of America, the Pakistan Medical Research Council, Federal Bureau of Statistics, and National Council of Health Services has conducted data in which the we have merged the demographic and health survey combined, and it is known as PDHS, that is Pakistan Demographic Health Survey, PDHS, which gives the information about the health of the general population. It not only gives the information about the health status of general population, but it also gives us information about the high risk groups. And the high risk group includes children under 5 years of age, female of reproductive age group, and the population which is more than 60 years of age group. They constitute the higher risk groups. So we also get statistics about the health of the high risk groups as well. It gives us information about the utilization of healthcare services, as I have already mentioned, and these all statistics help us to plan for the national health resources which are required for the country, and it helps us to plan for the provision of the healthcare services to the community. This is to show you that how the National Health Service divided into two components. One is based on the interviews only, and the other one is based on the examination. Most of the time, the surveys are based on the interviews, and in these interviews we want to get information about the socio-economic status of the population. We want to know about the age and gender distribution. We want to know about the occupational status, their income, their marital status, their health behaviors, and what are the risk factors which are generally contributing towards the disease occurrence in that population. The second component of the National Health Survey is based on health examination. And in this, the surveyor not only takes the interviews but conducts the health examinations as well. During these examinations, the one and the most very important component is the nutritional assessment. In nutritional assessment, actually weight is taken, height of the population is taken, mid-arm circumference is taken, and actually BMI, which is body mass index, is calculated. Not only the BMI is calculated, but the hemoglobin estimation is also done to see the iron deficiency. So in this type of assessments, examinations are being done, and not only the examinations are being done, but the lab tests are being conducted as well. The health examinations Under the health examinations, we also want to know that what are the chronic conditions which are present in the population, and we want to assess that what is the proportion of the percentage of the population which is hypertensive, what is the proportion of the population which is diabetic, is there any disability which is present in the population. We can also conduct ophthalmic surveys in which we can assess the refractory errors, and many other examinations, surveys can be conducted. For example, mammographies are done, For example, nutritional assessments are done. For example, the urinary tract infections and their assessments are done. So whatever the common public health problem is there, we want to examine the patients at the community level, and we want to conduct examinations. All these health examinations and health interviews contribute towards the National Health Survey. There is a directory which is maintained by the National Health Services in Islamabad in Pakistan, in which all the research which is published under the surveys is reported there. Pakistan Demographic Survey basically calculates birth rates, it calculates death rates, it calculates the natural increase in the population, it calculates different fertility patterns, which include the general fertility rate, general marital fertility rate, total fertility rate, abortion rates, etc. And all these rates are calculated, and then they are used for the comparisons at the local level, regional level, provincial level, and at the international level as well. The function of the Nadra in Pakistan is that it's a central database entry system through which can be accessed country-wise, and it contains the whole information of the country. It have an additional information about geographic and land information system. It means that the population which is present in a specific area which is demarcated can also be addressed, and their rates can be calculated. Uh, there is another system of registration in Nadra, not only for that population which is residing in Pakistan, uh, rather than uh, the local population, the expatriates are also registered. We know that how many of them are showing out migration, and how many from the other parts of the globe are entering into the our system. It also caters the needs of the dual citizenship. There is another card other than the national identity card, which is known as NICOP, and it is given to the dual citizens which have dual citizenship. So we have registration of all those people who are registered in other countries as well, other than Pakistan. Nadra is also involved in registration of refugees, and Nadra has given the national identification cards to all the Afghani population which has entered during the Afghan war and has stayed for more than 20 years in Pakistan. They have been given a card of registration which shows their status that they are refugees and they will be leaving back. And Nadra also registers birth rates and deaths in a population, so it helps us calculate the birth rates and the mortality rates as well. It is the other important function of Nadra is to maintain the population registers depending upon the geographic boundaries. Nadra is involved in a generation of bay forms, which are actually for used for the registration of the children who are under 18 years of age under a family number, which is allocated to their parents. Nadra also gives us national identification cards, which are given to the population which is more than 18 years of age, and until and unless a population member has his or her national identification card, he cannot be entered into the voters list. So we can match the voters list with the registers of the Nadra as well. Then I have already mentioned that all the data of the immigrants as well is recorded in the national registration system under Nadra. Whole data is collected in the National Data Warehouse. Then it is sent to the Planning Commission, and then it can be used to the sent to the provincial ministry and federal ministry for the planning phase and for the implementation of services as well. This is to show you can see that this is the actually request form for the registration of the births. This is used for the marriage registration, and this is the example of the national identification card. Another milestone which is achieved by NADRA is the introduction of the computerized chip in this national identification card, which can be accessed internationally, and it gives the complete information of the card holder. Other sources, as I have already mentioned, are health management information system. It basically works on the first level healthcare facility, which is basic health unit or the rural health center. And it works in close collaboration with the district coverage plans. It contains the information about the patients, all the patients who are being admitted, or all those who are taking services from the OPD, and what is the total number who is being benefited with the healthcare service provision, and how many of them have got the service delivery. So through all these sources, we collect data, we calculate rates, we generate statistics, we compare population of one area to another area, we compare the population's rates nationally, we compare them with the international level, and then we know that how we can rank our country with the information which is actually generated through all these sources. We actually get information about age and sex composition of the population. Age composition tells us that how many of them are in the bracket of this age group, and for age composition we assess this categorization with a graphic presentation which is known as population pyramid. It helps us to also calculate dependency ratio. And as the name is suggestive, dependency ratio means how many people are dependent on a single person who is working and is earning. With sex composition, the population pyramid, which is a graphical representation, also tells us about the sex composition of the population. That what is the ratio of male to female in a defined geographical area. Ideally, the ratio of male to females is 104 males to 100, or 105 males to 100 females, or 106. It ranges from 104 to 106. Ideally, Pakistan has the ratio of 105 to 100. It means that there are 100 males for 105 males for 100 females. So this is how the sex ratio is calculated. The sex ratio is calculated by the total number of males divided by the total number of females into 100. And this sex ratio is generated actually at the time of birth, and it shows in Pakistan currently there are 105 males for 100 females. Why the population of male should be higher than the female population in any country? Because the male gender is chromosomally it is weak, and it shows higher mortality pattern under 5 years of age. So most of the times the higher mortality rate in the male gender compensates with the lower number of the females. So it actually maintains an equilibrium in the population. This is the graphical presentation, a very famous one, and it comes in auspice stations as well. This is known as population pyramid, which gives us the age and sex composition of a population. How it represents is that this is the darker population is of the male, and the lighter population is the female. Sometimes it shows the color distribution of pink and blue, in which the pink color shows the female population and the blue color shows the male population. Majority of the times when the population pyramid is constructed, the female population is put on the right side and the male population is put on the left side. But you can see different variations according to the color coding. Now, so it shows that on this side we have males in this population pyramid, and on this side we have female population. And then each bar represents the age bracket of 5 years. For example, in the lowest graph, it shows about 0 to 4 years. It means 4 years, 11 months, and even 29 days will be calculated under this bar. And then, as soon as the child will enter into the 5 years age group, it will enter into the next bar. And this will go from 9 years to 11 months to 29 days, and so on and so forth. So each bar constitutes about 5 years. Now, how can we uh, depict population pyramid? This population pyramid shows that this is uh, this shows the higher base, the broader base, and a small tip, which means that the population of the lower age group is much higher, and the population of the age group more than 75 years is much lower. It means this represents a country in which the birth rate is very, very high. And it also shows that the death rates are high because in these 75 years, the population is very, very small. So, how we can interpret it further is that when the broad base reflects the high birth rate, then why the second bar between 5 to 9 years is greater than this bar? It shows that the birth rate was really high. It was much more than this bar. It should extend from this place to this place. And then with the higher mortality pattern in the age group between 0 to 5 years or under 5 years, this bar has been shortened. And then 5 to 9 years is slightly broader. These are the surviving children who have survived this lethal time period. And then from this onwards, there is consistency, but we can see that we can counteract with different types of mortalities even after that age group. And concurrently, you can see that for each age group, the population is decreasing. The population is decreasing. It means our healthcare service provision is poor, and each age bracket is actually exposed to higher risk of death. So this is the presentation of population pyramid. The population pyramid not only shows us age distribution, as you can see, but it also shows us about the gender distribution. You can see males and females. You can calculate the gender ratio, sex ratio. For example, for each group, for example, if we want to calculate the gender ratio in this group, we can see that during 30 to 34 years, we have a higher number of females as compared to the males in this group. And the reason for this is that majority of the males in this age group usually go out for employment purposes. So the number of population, female population in that area is much higher as compared to the male population. We can also tell about the birth rates, as I have already mentioned that the broader base shows that the birth rates are high. We can predict about the women in childbearing age group. You can see that the childbearing age group starts from 15 to 49 years of age group, and you can see that it makes a greater burden of the population, that we have a large number of potential females who can produce babies in this population. It shows about the fertility patterns, as the broader base shows higher fertility rates. It tells us about the population momentum, as I have already mentioned that the smaller male bar shows that the male population has gone out for the occupational purposes. It tells us about demographic transition, that this is in which stage this is present. As we can see that the broader base after 15 to 20 years, this broader base will be coming in the middle, and then they will be producing more children. And when they will be producing more children, there will be much more exponential growth of this population. Even if the population is producing only two children, which is actually having the replacement level fertility, even then the population will double, because this population, which is making the broader base, will come into the middle, and it will produce a large number of children. So we can also predict dependency ratios, that what is the total number of population which can be dependent on one earning member. It can tell us about the median age group of the population. It can tell us about the mortality patterns, as I have already predicted that the mortality pattern in the age group of more than 60 years was very, very high. It can tell us about the migrations. It can tell us about the health status, as I have already mentioned that this lower bar shows that the healthcare service provision is poor. It has high infant mortality rate. It has high under 5 mortality rate. So all these informations can be predicted from the population pyramid. So my question to you is now that how will you interpret these three patterns of population? This is actually um, the population pyramid of Kenya. This is the population pyramid of United States of America, and this is the population pyramid of Germany. Now you have to tell me how you can predict these population pyramids. As you can see, the broader base shows that in Kenya we have high birth rates. We have high under 5 mortality rates. As with each bar, the population is decreasing. And as the services in Pakistan are poor, we have very less geriatric population in Kenya. In case of United States of America, you can see that the base is small and the population in the reproductive age group is higher. It means that this population is not interested in producing children. The birth rate is really low. But as the birth rates are low, but the death rates are very, very less, and almost the bars are equal, which shows that the healthcare service provision to the children is exemplary and the children are not dying. The main bulk of the population constitutes the reproductive age group and the productive age group, which are economically stable and they are doing jobs. So the country is showing higher GDP and GNP. Then we can see that the geriatric population, which is more than 60 years of age group, shows much more high population as compared to Kenya, which shows that the healthcare service provision is so adequate that the people have longer life expectancy and they are living with better quality of life. Then going towards Germany, you can see that the base is very, very low. It means the Germany is going into the negative growth. It means the population, which is actually in the reproductive age group, is not interested in producing children. Their children are even less than two. They are not even replacing their population, but their healthcare service provision is adequate and the geriatric population is there. But you can very well imagine that the female population in the older age group is much higher. So you can predict that the life expectancy of female population in Germany is much higher. The growth rates are very slow, birth rates are less, mortality rates are less, dependency ratio is less, as majority of the bulk of the population is in the reproductive and the productive age group. Fine.